What are current staffing levels in your unit? Is there a concern for lack of resources currently for staffing? Okay, so that's a good question. So in the summer when we had kind of a little surge, it was pretty hectic. Luckily, in my ICU, we stayed at about 1 to 1 or two patients to one nurse. But we also had to add extra help from our charge nurses who usually take care of the entire unit. But in our case, a lot of our charge nurses also took on patients uh, because we were so busy. So as far as resources and masks and PPEs at my hospital, we are okay on that aspect. What is really impacting though, or what is really impactful from COVID that not a lot of people talk about is the medication shortages, excuse me. But what I'm seeing from the pharmacist point of view is a lot of our ICU medications, our drips to keep people sedated, our remdesivirs, our tocilizumab, which is another treatment for COVID-19. All of those medications that we use for COVID-19 patients are actually on a severe shortage. So everybody in the entire country is trying to scour different wholesalers, manufacturers, just to get these drugs to get us by for the next COVID patient and also the next ICU patient. So from a resource standpoint, PPE is okay at our hospital. Staffing is decent. I feel like when we reach the fall and winter, it's going to be a little bit more hectic. I know that for me, last fall and winter, in general, I take care of about 20 to 24 patients. In the fall and winter of this past year, during the big surge, I took care of at least 30 to 35 patients. So my load was up by like 30%, which is pretty hectic when you're in the ICU by yourself. So I expect if we do have a surge, our resources will be a lot more scarce, and that includes staffing as well.